I'm Khair. I am by background a haemophilia nurse, having worked at a children's haemophilia treatment centre for 30 years. Whilst there, I undertook a PhD into the lived experience of children with haemophilia, and that really developed my interest in the patient experience and the patient voice. I'm now the Director of Research at Haemnet, which is an agency which does research in mostly the bleeding disorders community and mostly around what it's like to live with a bleeding disorder from the patient and the family's experience. I think it's really important to understand the patient and family experience of living with a bleeding disorder. As a healthcare professional, we think we have some insight, but actually I don't live with a bleeding disorder and I don't know what it's like to have that in my family every day. And one of the things we're not good at is asking patients and family members about the impact on them in a daily routine and daily focus. And because we don't ask, they don't tell us. And so that's why I think what we do at Haemnet now is really important, because we're trying to dig really deep into what it is like to live with a bleeding disorder today. The current state of treatment for people with von Willebrand's disease or Glanzmann's really varies depending on where you are in the world. So obviously the first problem or priority, depending on which way you want to look at it, is to get a diagnosis. And for many people, that's very difficult. Then once you've got a diagnosis, it's about being able to access treatment. And if you've got von Willebrand's disease, again, depending on where you are in the world, you might be able to access treatment easily for either when you bleed or as prophylaxis. Prophylaxis tends to be given only to people who are perceived to be bleeding a lot. And again, this is something where we're not very good as healthcare professionals are asking the right questions about how often people bleed and the impact that that bleeding has on their life for them. For people with Glanzmann's, there is not really the access to prophylaxis that there is for any of the other bleeding disorders. So a few patients are able to be treated at home with recombinant activated factor 7, but for the majority of people who are bleeding significantly, they need to come into hospital for hospital delivered care, which is predominantly platelet infusions. And that obviously is more burdensome because it means they've got to miss time from school or work, they've got to travel to the hospital, and we know that sometimes the platelets themselves don't stop the bleeding, or patients develop antibodies to the platelets and then they have more problems with stopping bleeding once it occurs.